Hello, my name is Hilary Alban. I'm a student of Universidad Católica Santiago Guayaquil, and today I'm going to share with you an interesting topic, which is Pyoderma Gangrenosum in ulcerative colitis. Definition is an ulcerating inflammatory skin disorder that can be associated with an underlying systemic disease, such as ulcerative colitis. Applications in medicine. Pyoderma gangrenosum usually starts quite suddenly, often at the site of a minor injury. It may start as a small pustule, red bump, or blood blister. The skin then breaks down, resulting in an ulcer. The ulcer can deepen and widen rapidly. Characteristically, the edge of ulcer is purple and undermined. Several ulcers may develop at the same time or over months to years.
So let's start with this picture. And as you all try to figure out what happened and could it happen to you, Dr. Batra, what did happen?
So this is actually a very zoomed in picture, and I think if you go back, you'll actually see the part of the normal skin on the breast. This is a condition that's really quite rare. It's called Pyoderma gangrenosum, and it's a condition where when you have an injury to your skin, in this case, the picture is taken from a woman whose photo went viral. She was scratched by a cat. But what happens is all of these inflammatory cells rush to try and heal the injury, but they get stuck, and there are an overabundance of cells called neutrophils. And the way I always kind of think of this in my mind is like when there's an accident and all the bystanders are in the front lines, that the first responders can't get there and actually fix the problem. That's what's happening here. You actually have all of these inflammatory cells that are not meant to be there crowding out the actual wound healing that's meant to occur. So anytime someone gets an injury, it just becomes this horrible, painful, non-healing ulcer. And this is actually really challenging to diagnose because you have to rule out all sorts of infectious causes and other possible reasons for this. You have to diagnose this on biopsy. It's much more common in people with other autoimmune conditions or certainly inflammatory bowel disease. And it's treated by very long courses of anti-inflammatories. So sometimes we were just talking about a couple of cases of mine in my clinic where it's taken months to years of long-term steroids or anti-inflammatories to actually make this get better, and does heal with pretty significant.
Pros and cons. Pros. About half of treated patients achieve wound healing of treatment with prednisone or cyclosporine within a year. Treatment of Pyoderma gangrenosum is mainly non-surgical. The necrotic tissue should be gently removed. Cons. Patients with Pyoderma gangrenosum should be very careful to avoid trauma, which can set off a new ulcer. Untreated, the ulcers may continue to enlarge, persist, and change.
Gangrenosum is a rare and very painful skin condition that causes rapidly spreading ulcers on the skin. It's an autoimmune condition that's also associated with other autoimmune conditions such as rheumatoid arthritis. Pyoderma gangrenosum can sometimes be treated with topical medications such as potent or superpotent topical corticosteroids, but usually systemic therapies are required. And the two most commonly used systemic treatments are oral prednisolone, which is a steroid medication, or cyclosporine, which is a drug that affects the immune system. And we wanted to compare these two most commonly used systemic therapies head to head in the stopgap trial. Doctors and patients can choose either of these treatments, safe in the knowledge that whichever they choose is likely to have similar benefit, and they can choose one that suits their own preferences or their other comorbidities that patients might have. Our big surprise really was that neither medication worked terribly well. After 6 months, less than half of the patients' ulcers had healed, and in those who did heal, 1 in 3 had a repeat attack.
Issue apply in Ecuador. In Ecuador, 10 years ago, this type of disease was not treated frequently, but currently there is an incidence in the increase of new cases. There is a high incidence in people who are around 50 and 70 years. Colitis is known to be prevalent in urban settings, having fewer defenses against the disease than people in rural areas.
I went through the biopsy results as well as the blood test results, and they all support a diagnosis of an inflammatory condition where the immune system is, we believe, dysregulated, where we think there's almost too much inflammation at sites of injury, and it's called Pyoderma gangrenosum. And interestingly, the one on your shoulder is very classic for a specific subtype of Pyoderma gangrenosum versus the one on the face isn't quite as representative, but certainly fits the picture. Now, we're all set up to do a biopsy, and ordinarily I would, but the concern with this particular condition is the inflammation that occurs at the site of an injury can often make the ulcers worse. So my concern is if I went ahead and I did the biopsy, I would be introducing yet another site of injury that could subsequently worsen and ulcerate as well. So I have some ideas for really new and excellent treatments that we could initiate and start that would hopefully help these sites heal. But before I can start the therapy, there's a test I have to do just to make sure you haven't been exposed to tuberculosis. This is just a PPD test that you may have had before.
Okay. Conclusion. Pyoderma gangrenosum presents as a rapidly enlarging, very painful ulcer. It is one of a group of autoinflammatory disorders known as neutrophilic dermatosis. The prognosis for Pyoderma gangrenosum is unpredictable. About half of treated patients achieve wound healing and treatment with prednisone or cyclosporine within a year. Patients with Pyoderma gangrenosum should be very careful to avoid trauma, which can set off a new ulcer. Thank you.